Hello and welcome to our presentation on the traditional Inuit and their death and dying rituals. First off, let's just talk about who the traditional Inuit are. So the traditional Inuit are self-sufficient people who live off the land and sea in the northern regions of Canada, the United States, as well as Greenland. And as of 2016 statistics, there were approximately 150,000 Inuit worldwide. 65,000 of those people residing in the Canadian region. So here is a map of the Inuit distribution based on the dialect spoken. So as you can see, just by each color depicted there is a different dialect spoken. And I'm not even going to try and pronounce any of them that are up there, but if you'd like, pause the video and you can see if you can pronounce any, but good luck with that. And what is also unique about the Inuit is that they actually developed their own sign language, and it's actually said that today there's only 50 people that actually speak it. So there's actually a movement going on right now that they're trying to implement that it be taught in the schools so that it's not gone into extinction. And you can see by the northern orientation of all the different populations that they had been cut off from Western influence until actually quite recently in the grand scheme of things. So they've had to adapt to live in their harsh environment and weather in order to survive. One very important adaptation was their clothing. And most of us are familiar and have seen Inuit on television. But what you may not know is that the coats that you have saw are actually made of caribou that was harvested in the summertime. And that's just due to the fact that in the summer the coat is a little bit more lightweight than it would be in the wintertime, and it's just as strong and most importantly just as warm. On the left you see the amati, which is worn by only the women, and it features a large oversized hood on the back for carrying small children and babies. And on the right, you'll see the anorak, which was only worn by men. And you'll notice that there is no oversized hood on the man's coat, just due to the fact that the men were thought to be the hunter-gatherer providers for the family. So they weren't traditionally seen looking after the children as often as the women would have done. The next adaptation that the traditional Inuit had in dealing with their adverse weather was their lodging. Now, everyone always assumes that everyone in Canada lives in igloos, but in fact it is actually only the Inuit in the northern regions that live in the igloos, and of course they can only do that in the wintertime when the snow is plentiful. And on the right, top right, you see the two-peak, which looks a lot like a teepee. And in fact, it really structurally is. It has the same wooden poles used for support, and then they wrap it in animal hides for warmth, much like the Native Americans did. And at the bottom, you can see it's called a karmak, and it's more of a permanent structure. And this particular one I thought was quite interesting because the framework is actually built out of whale bones, and then like the two-peak, they would use either animal hides to surround it, or they would even use sod, and they would make a sod house out of it. And obviously this is more of a permanent structure, whereas the other ones were just temporary lodging. And it was these adaptations, as well as many others, that were paired with a unique set of skills that gave the traditional Inuit their unique identity.
The Inuit belief system. The Inuit belief system has a very strong spiritual background. They believe that all things in life are equal and should be treated equal. When dealing with death in this culture, it is not something that they fear. Inuit people have a very strong belief in reincarnation or rebirth of the dead. They don't view death as the end, and they only view it as a journey until that person comes back and is born once again. It is said that with reincarnation, the person doesn't exactly come back the same, but they will hold the same characteristics as before. The warriors of the past will have scars in the place of the wounds that they once had. The elderly will be reborn with teeth and gray hair, or develop it early into their new life. and the stillborn will be reborn once again and given another chance to life. So with reincarnation, there are a few different types. The first is human to animal reincarnation. This is just as simple as the person coming back as an animal, and animals are said to be able to return as humans as well. The second is cross-sex reincarnation. This is common in the culture, and this is just when the person comes back as the opposite gender, and this can change with each rebirth. There are some stories of individuals that reincarnated 4 times and switched genders each time. With these cases, it is common for people to cross-dress until around the age of puberty just because it is hard to get used to the changing genders. The last type is multiple simultaneous reincarnation. This is when one returns in or as several people at once. This is quite an interesting concept to think of, as it is not common in other cultures to have one be able to come back to life as many different people. With all cases of reincarnation, it is thought that people who experienced unexpected or violent deaths that they will have the highest chance of being reincarnated, which gives them a chance to a better life since their last ended badly. The belief of reincarnation is also used for naming practices. There's a procedure called name soul, and this is when a newborn baby is named after someone who has recently deceased. It is thought that the infant will then be a reincarnation of that deceased person. The infant will show symptoms of being sick and cry until it is given the name of the person that it has truly come back as. The symptoms will stop as soon as that name is given and the reincarnated person is rightfully identified. This naming practice is thought to provide a guardian spirit protection for a child from a deceased and not yet reincarnated relative. Being named after one another, generation after generation, increases the numbers for that name and forms a long chain of protectors for the individual that bears that name. All in all, the Inuit culture has very strong spiritual backgrounds. In the indigenous culture's eyes, the world is seen as a place in which harmony and balance exist between and among human beings and spiritual or other than human entities. The Inuit's outlook is something that other cultures could learn from. Seeing how death is often feared by many people in many cultures, even though it is a natural human process that will happen to everyone. These strong beliefs and spiritual backgrounds help to shape their interesting outlooks on death and the afterlife.
Hello. For today, I will be presenting on the Inuit preparation and disposal. Initial death. Once the person has passed away, the body is prepared for its transition to the spirit world. That transition is dependent on gender. If the body is a male, the hair is done to look like it would be before death. Then the body is cleaned and washed so the person can look similar to when they were alive, so the person would have the same physique in the spirit world. If the body is female, the hair is braided at the start and braided all the way to the bottom of the person's hair. Then once again, the body would be washed and cleaned for an easier transition into the spirit world. Body preparation. Once the body is cleaned and prepared, the person would be wrapped in furs. The fur had many meanings for the Inuit. However, one of the main reasons that they wrapped the body in furs was to not only have respect for the family and cover the face, but protect the body and preserve it from salvagers and vultures who would take the body apart and dismantle it. This would be considered extremely bad because it would wreck the body and the person's transition to the spirit world may be disrupted. This fur was usually from an animal, specifically the caribou. The fur was usually from caribou because it was the most accessible animal in the tundra and they would hunt them constantly for food, so the Inuit people would have an abundance of their furs. Beliefs. There's 2 beliefs about the spirit world that affected body disposal. The Aurora Borealis. Many Inuits believed that once a person passed away, their spirit would travel up into the Aurora Borealis and be able to dance among the stars for eternity. This affected the way that the body was disposed of, because the belief was that when the person was wrapped in furs, their face had to be facing the stars to allow for the easiest transition to the Aurora Borealis. However, some Inuits believed in the underground world. For the rest of the Inuits, they believed that the spirit world was all underground. This was because of the harsh conditions on the tundra, with the lack of food and the extreme cold. It was believed that the underground was an extremely warm location which had an abundance of food. When a person passed away and they wanted to move on to the underground spirit world, the body was to be placed facing the ground. This was believed that when the face was facing the ground, it placed the soul against the ground and allowed for the spirit to easily seep into the underground world. These differences in beliefs affected the way that the bodies were disposed and affected their beliefs on which spirit world would go to. Finally, we have the procedure. When the person passed away, their body would be moved away from the village. The body would be taken far away from the village, not only to allow the family to grieve, but in the hopes that the deceased person can transition to the spirit world easier, and some even believe that the spirit may haunt the village if the body is disposed of in the village. The body would be placed on the tundra without a tombstone. The Inuit people did not believe in burying their people in tombstones or defined graves. This was because the person would hopefully transition in the spirit world, and therefore did not need a grave.
The Inuit people of northern Canada, Alaska, and Greenland all have very similar views, as well as the great sense of community, which allows for grief to affect many families, towns, and communities. Many Inuit people struggle with grieving for a number of reasons, such as grief of a loved one, multi-generational grief, as well as ecological grief. Another reason Inuit people might struggle with grieving is the pain of feeling torn between trying to balance their traditional practices with modern clinical ways and having access to the resources and able to help with their grief. But many Inuit communities believe that lots of their traditions have been lost due to the assimilation of their people. With the loss of their traditions comes my point of multi-generational grief, which is the fear and pain caused by residential schools, assimilation, and the destruction of their culture and beliefs passed down through generations of their families, causing drug and alcohol-related problems, as well as high suicide rates and depression in their communities. The Canadian Inuit that reside in the Northwest Territory region has the highest suicide rates in Canada. Yet the suicide rates for Inuit people as a whole are amongst the highest in the world. However, not all of their traditions have been forgotten. A traditional Inuit ritual to deal with grief was for an individual to lie down on the floor of a quiet, dark room and to spend the day taking the time to reflect on their situation, connect and process their emotions, as well as accept their memories for what they are. This process was believed to help the individual heal their mind and spirituality from the negative aspects of grieving. Assimilation has made the Inuit communities feel as if their traditional values of perseverance, always moving forward and never giving up, have been replaced with disorder, confusion, dysfunction, and fear. Another example of a traditional grieving process is the practice of sweat lodges. This was used as a form of healing because it was believed to cleanse the body of all negative toxins inside it that would pollute the mind and the spirit of being able to heal from their past experiences as well as their grief. Sweat lodges are still widely used today and are popular across many communities other than just the Inuit, such as the Métis and the First Nations people. As the time passes further away from the loss of the Inuit culture, they have found the time to bring back their culture, their language, their beliefs, and spirituality, as well as teaching it in the schools to the younger generation to allow for traditional knowledge to once again be passed through future generations, which will keep the culture of the Inuit people alive.
I'm apologizing in advance. I am sick, so my voice will sound a little groggy, but I will try my best. For this slide, I will be talking about the death rituals. The traditional Inuit death rituals are focused around their belief systems with the journey of their spirits into the afterlife. However, a violent death such as shooting, stabbing, strangulation, and hanging allowed the spirits to remain at peace. Suicide had been a major role in the Inuits' rituals, which explains the high statistic rate of Inuit suicide. Studies have stated that it is 5 to 6 times higher than the average in Canada. This had also become common in young males because of the stresses of their lifestyles and the assumption of them being the providers. Traditional Inuits had believed that suicide would stabilize the forces in society. This ritual pertained mainly to elders and female infants. Elders were often the most to be seen in these rituals, as they became useless to the community's well-being and survival. Most of the deaths had been used for the purpose of relieving the community's burdens and disgrace. If they had outlived their usefulness due to dependency on others, their obligation was to be killed by shooting or strangulation. If agreed upon, the victim could complete suicide publicly. They would have a specific location, and their clothing would be placed inside out with the destruction of their possessions. But if they had claimed to die a natural death, which they would ask their children to murder them, the following destruction would not be involved. The executioners would be confined for 20 days and could not work, touch food directly, or change the clothes that are also inside out. The impacts of leaving their clothes inside out was used mainly for the feeling of being dead. However, if the victims retract their suicide vow, dogs would be sacrificially killed to prevent the influence of evil. Other rituals that take place in the Inuit culture is the sacrificial killing of female infants, which is also known as female infanticide. They believe that newborns can be reborn later or oppose the humanness of the newborn. To ease the effects of suicide, the doomed newborn would be named after the deceased. Females were less desirable than males because they weren't an important aspect to the community, which increased the death rate of females. This was influenced by their different lifestyles and gender roles that made women rely on males. The Inuits' belief system shapes their conception of death and the rituals that mainly pertain to certain ages and genders. A violent, painful death allows the spirits to be at peace in the afterlife. This allowed the Inuits to free themselves from suffering and decrease the negative impacts on their community. The traditional Inuits' rituals were impacted by fear and precautionary measures due to their harsh environment and lifestyles. Overall, their death rituals are involved with the idea of peace and achieving this in their journey to the afterworld, which is presented by a cruel death.
All right, so professionals is kind of a broad term. A lot of different people can fit into that. So we've decided to look at it from a healthcare professional point of view. So the Inuit people have a huge emphasis on their connection to their land and how that ties into their health and their well-being. So understanding that connection to the land can allow professionals to provide better care, client-centered care, which is crucial to proper health care. So the Inuit have a belief that life and health require complete linkage of the body and the soul. If the body becomes sick, the soul will weaken. So they state that health and vitality comes from consuming the country foods. So these would be foods that are native to their land, such as caribou meat or seal blood. In fact, seal blood is seen as life-giving or fortifying for Inuit blood. It's what gives them strength. So in times of illness or weakness, they will often consume more country foods to give them strength. They believe that Western medicine and the Westernized diet actually makes them weaker. So with assimilation causing more of that Westernized culture and food and diet being pushed on them, they're finding more and more chronic illness within the population. So just like the rest of Canada with our processed foods leading to cardiovascular disease or diabetes, they're seeing spikes in that within the Inuit populations as well, just because now they're in their remote communities and the only food they have access to in a grocery store is the Westernized processed foods. So these chronic illnesses are leading to more and more people, not just elderly, but people in general, having, lifelong diseases that are increasing their mortality. The elderly or the ill people, they don't want to feel like a burden to their family. That's not anything they want to do. So there is some people that are opting more for suicide. So there are more deaths associated just based on chronic illnesses, and they're not necessarily getting to like live that whole long life, but they're perhaps dying from complications from diabetes or heart attacks, things like that. Understanding the Inuit death and dying rituals is crucial because it allows us as professionals to help support those customs and supporting our patients as they may be grieving the loss of a loved one or supporting a patient who is currently dying. We are, by supporting these rituals, we are able to help maintain their cultural identity. If they're dying, we can help maintain that cultural identity up until they die, or ensuring that the rituals are that the rituals take place and that their soul can move on the way it is supposed to, allowing for not just that person to maintain their cultural identity, but their family and their loved ones that they're leaving behind. They have that cultural aspect that helps them through the grieving process. So if us as professionals in healthcare, whether that be the medicine side or even the psychiatric side or the psychology side, we can help those who are grieving and have just lost a loved one, help them find peace with the fact that knowing their loved one's soul has moved on in the correct way, that it is being taken care of, it's crucial. That cultural identity is absolutely crucial.